the Burns Lake Veterinary Clinic, and today has been a great day so far because little Dusty here has had a bunch of his needs already met. He had a good breakfast with lots of clean water. He got a little bit of a rub down with the brush and some love. But there's one thing that he hasn't had yet today, and that's veterinary care. And that's very important for your dogs and cats' health, is make sure they get a trip to the veterinarian at least once a year, whether it's a cat or a dog. It's just like people, sometimes you need a checkup to make sure everything's going okay, and that's what we're going to do with Dusty today. Give him his annual checkup, and he can get his vaccinations to keep him healthy and to keep the diseases away. So we're going to go in and get that done right now. You could just sort of explain all the things that you check for when a dog comes in.
Yeah, we kind of just look at him generally to start with, and then we start from the tip of his nose and go to the tip of his tail, literally. We check his teeth for staining and gingivitis. Then we check his eyes, of course, for any signs of ulcers or redness or irritation like infection, and to make sure he has a bright, kind of shiny, healthy eye. We check ears in particular because ear infections are common in dogs.
I just hope they get
that his ear is nice and pink and healthy and no extra wax down there. And then we always check his lymph nodes down below the ear to make sure lymph nodes in the head will drain infections of the teeth, eyes, and ears. So we always want to make sure the lymph nodes are a normal size so there's no infection present for him. Then we always check his other ear, of course, so it's nice and pink and clean and healthy. And then we just check his hind legs, the same thing, check the joints and make sure there's no swellings or their little stifle joint here is a common problem for cruise ship injuries, so a ligament rupture in that joint, and it can cause lameness in dogs. And then we always listen to his heart and his lungs to make sure he's healthy. But we check the heart just at the point of the elbow on either side. A little piece of food, because then we can give you your shot. Can't we? Hey, son. There we go. Here. And so it just goes under the skin, and usually in just kind of the scruff of the neck where they have lots of loose skin, and so then the dogs don't feel it at all. Gee,
And what are the vaccinations for?
Up here, the ones we worry about the most are distemper in mature dogs, because they can get distemper from foxes and coyotes and wolves. And parvovirus in younger dogs, because it's an intestinal viral infection that causes really bad vomiting and diarrhea.
So now we can check out his weight.
Yes, we'll weigh you. Okay, so he's 19 kilograms, 43.4 pounds today. So he's actually lost a couple pounds, so he's on a good little diet and exercise program.
So you can see that Dusty loves his trip to the vet. He's not concerned. He's not upset, and he just still got a smile on his face leaving the office. So.
Yes, that's right.
Thank you, Lois.
Thank you, Alistair. We'll see him again in a year.